everyone. I am Neetu Singh, PhD scholar at Indian Institute of Science, and today we have Dr. Praveen Kumar, Associate Professor Anatomy, AIIMS Bhubaneswar. A very warm welcome to Treat DM 2025, sir. It was an insightful talk listening to you. And further, we would like to understand your larger vision and the long-term goals that inspire your work and your teaching at AIIMS Bhubaneswar, keeping in mind the field of anatomy.
Especially in anatomy, we want to teach our undergraduate and postgraduates beyond morphology. They need to think in the aspect of its histology and its molecular term to link it with the disorder beyond the morphology. And when we ask about the longer goal, since we are working on a pancreatic islet, we want to establish a baseline data of Indian population in terms of especially the islet morphology and various mechanism leading to type 2 DM, so that we can able to practice precision medicine based on the data available from the Indian population.
Exactly, sir. As you very rightly mentioned that we need this, that you are very much working towards getting this database for the Indian population done. And considering the diverse burden of diabetes in India, why do you think it's important for us to study the islet morphogenics or the islet dimensions with respect to the Indian population?
In our recent study, we have quantified the islets and beta cell, even the alpha cell from a non-diabetic Indian population, which is the first of the study of this kind in Indian human population. So based on this data, we can say Indians are having lower amount of islet when compared to the Western population, and we are having more amount of beta cell surprisingly, even though the beta cell percentage is more. This is because we are having predominantly smaller islet. When the islets are small, it will be leading to increased proportion of beta cell, but these beta cells are not much useful to us, since the larger islets, when the beta, even though beta cell proportion is less in it, the intermingled arrangement of larger islet will allow the beta cells to sense more glucose even in its lower concentration, and which will be facilitating the more beta cell secretion, that is the insulin secretion, by paracrine effect. So since we have built this baseline data, currently we are working in an aspect of the various mechanism which leads to this. So with the fetal pancreatic development, we have checked those things. Then we are now moving towards the various mechanism which is lead to the onset of diabetes and the progression. So with all this, we can able to build the personalized database for the Indian population. So we can depend on those for the personalized treatment, precision medicine.
So, as you very rightly mentioned that there's a need of this Indian personalized database. In a similar lines, how effective do you think platforms like Treat DM are in fostering a collaborative approach to understanding healthcare and research specifically in India?
Yeah, we need to have such a platform like the TR stands for translational research. Here, these kind of platform attract. During the presentation itself, I have seen like the studies from the basic science, even various alternative medicines, and also the clinical trials, and the even some AI experts are there. So this thing will bring everyone together, so that we can have a kind of collaboration. We can have the lot of collaboration initiated from this platform. So this is needed for the metabolic disorder like diabetes, because this is a multifactorial. So we need to interact with all the other field to make a proper collaboration. So which will further give us the proper multifactorial data, which will give some output at the national level.
So lastly, I would like to ask you, if you have to give an advice to the young aspiring researchers and clinicians, what would that be?
Actually, I'm not a right person to give us advice, because even I'm in this field for around 8 years, so I am also young. So what personally I feel, not advice, like what personally I feel like during the even the undergraduate to the post-graduation, we should first strengthen our knowledge in the field in which we are there. So which will form a proper basement on which we should always open for the collaboration with the other field, because only with one thing we can't able to do. So we should collaborate with the various discipline within the, even within the medicine. We should have collaboration with multiple department, and outside the discipline also, like with the recent advances AI and all, we need to have a lot of collaboration. And with that, if we build our research starting from basic, what we are doing from the histology slide, so later it will be progress up to the national level implementation program. So it is based on the collaboration and having the sound knowledge on the area or the field in which we are there.
Very rightfully said, sir. So finally, thank you for your precious time and your valuable insights. It was a pleasure having you at Treat DM.
Thank you, ma'am. Thank you for the invitation.